All right, I think we're in. I put a little comment in the comment box. If you guys could put your name and your agency or your county, where you're from, give us a little idea of who is here. See lots of diversion program people. Excited for the upcoming statewide diversion tool. Awesome. I'm Dr. Lindsay Wiley. I'm the Director of Research at the Juvenile Justice Institute, and I am co-presenting here with Dr. Zachary Hamilton, who is one of our new colleagues at the University of Nebraska, Omaha in the School of Criminology and Criminal Justice. He'll introduce himself a little further when he takes over halfway through the PowerPoint, but basically what we're going to talk about today is developing a statewide diversion tool. So I'm going to talk a little bit about juvenile diversion in Nebraska and some of the things that we have done and accomplished here in the state. A little bit about the risk needs responsivity framework and assessment tools currently being used in juvenile diversion, and an evaluation report that the Juvenile Justice Institute conducted, looking at much of your assessment data that you provided to us. And then Zach will take over and talk about the next steps and what the work that he's going to be doing under contract with the Crime Commission to develop a statewide juvenile diversion tool. So under statute in Nebraska, one of the overarching goals of diversion is to provide eligible juveniles with an alternate program in lieu of adjudication and reduce recidivism. So to do that, we have to have effective diversion programs and effective practices that are shown to reduce recidivism. Also under statute, it's required to provide screening services for use of developing a diversion plan. It doesn't say in statute which tool should be used. So currently up until this point, most programs have used the tools that they want to use. We've had some tools that are consistently being used, the YLS, the NYS, and at times the Arizona. But not every diversion program is even using a risk assessment tool. Some programs are using the MAISY, so a mental health tool, and some others are using the JIF, which is more about pre-post and kind of more functional assessment. So the goal of this is to kind of analyze the data that has already been collected in terms of assessment, how useful and how well it's working for different groups of kids, and using that data to develop a tool that is normed for kids in our state. So what does it mean? We have to provide effective services and we have to screen them in order to do that. Well, according to the risk needs responsivity framework, we want to target our interventions. The more severe, the higher intensity services should be directed at those who are higher risk. And conversely, our lower risk youth should be receiving less severe services or none at all if they are deemed to be our lowest risk. And then in determining what types of services should be provided in diversion, or what that diversion plan should look like or not look like, if you're going to do something like a warning letter for the low risk youth, needs should be looked at, and those should be what is the target of the intervention plan, right? So it is most important to identify the need and the risk of the youth first, and then develop the diversion plan around those risks and needs. And that is, in being responsive, we want to make sure that services are matching the style of learning and the ability of that individual. So being responsive to their individual needs. Maybe somebody is not an English speaker, so the services should match their preferred language, for example. So what does this mean? This means that one size does not fit all, right? So I know in some communities, the diversion plan is pretty standardized. Every kid gets the same services, but according to the risk needs responsivity framework, each diversion plan really should be tailored to the risk of needs of that individual youth. And that is written in the state guidelines that juvenile diversion programs must match the risk and needs of the individual youth, that they should be tailored to those individual youth needs. And we conducted a study here in Nebraska with one diversion program that does follow the risk needs responsivity framework. And we found that youth who were successful in that program were less likely to have recidivism upon successful completion of that program. So what has Nebraska done so far? I feel like we're very fortunate in the state. We have an overarching, juvenile diversion coordinator. I can't remember what Amy's official title is, but we have somebody who's overseeing it. We have collaboratives. We have a lot of constant communication. You have the Juvenile Justice Institute and the Juvenile Case Management System that's really been able to give us information and learn and be able to inform our practices in diversion. Produce juvenile diversion guidelines and toolkits. There's been collaboration with the Office of Dispute Resolution. So a lot of diversion programs are now using restorative justice and mediation in their diversion plans. Provided advocacy and training. Building, so the juvenile case management system just changed within the last couple months for diversion programs to be more in line with risk needs responsivity. And so clearly the next step with all of this is to have a statewide diversion tool. So those of you who are using the juvenile case management system and entering the diversion cases into that, you'll see that the biggest part of the change is that we're asking for you to provide the assessment data, the diversion plan, to be able to identify the risks and needs, and the diversion plan should specifically be targeting the risks and needs identified for that youth. All right, so assessing youth and diversion. There's basically screeners and assessments are two different things. So screening is being able to identify those who may need immediate services. So it's kind of like the first step, right? And evidence-based practices actually is that we start every youth with a screener, and then we only assess youth who indicate from the score of the screener that they need a full assessment. So the assessment, though, is the more comprehensive, individualized profile, and the idea is that not everybody would get the full assessment. Only those that demonstrated needing the full assessment from the screener would be identified in the assessment. So why do we do this? Why do we have this process of screening and assessment? Well, it assigns youths to level of treatment and security, and it allows us to identify resources, right? So if every kid is getting these very large diversion plans with lots of different activities and things that have to be paid for, that's not as good and efficient use of funds as only providing those more intense services and paying for those more intense services for youth that require it based on their risks and needs assessment. And it can also help understand what the community needs, right? So currently we're working on these needs assessments for all of the communities that participate in the community-based aid funds. And one thing we were able to do is to look at the mean values of all the domains from the risk assessment scores to be able to see, hey, substance use is really your highest domain in this community. And that can help with community and strategic planning, because if we know a lot of our kids are having substance use issues, then we need to have those types of services in order to provide, because it's a high need in the community. So it's not only being used for individual level, it's something that can be used at the community level as well. So like I said, Nebraska statute for juvenile diversion requires that the program screen or assess the youth before participating in the program, but there's no required assessment tool at this time. So the most widely used tools when we went on site, so we conducted this assessment or evaluation last year, so 2019, and we went on site in most circumstances, and sometimes we got digital data for 2015 to 2017. So if you're thinking, hey, wait a minute, I used to use that tool, but now I'm using something different. What I'm presenting is older data, and one of the reasons we collected the older data is because we needed some time to pass in order to look at how predictive the assessment tool was of recidivism. So everything I'm presenting here is data from 2015 to 2017. And programs then used the Arizona Risk Needs Assessment, or the ARNA, the Nebraska Youth Screen, or the NYS, the Youth Level of Service Case Management Inventory, or more commonly called the YLS. So the goal of the evaluation of screeners and assessment was to see if those three tools have predictive validity. So predictive validity is so risk assessment tools, the goal of them is, one of the goals of risk assessment tools is to predict risk, right? what risk level is this kid, and what are they at risk for committing future offenses, right? So we looked at 2 time points, whether they successfully completed, whether the risk tool predicted successful completion of diversion, and whether the tool predicted future system involvement. So that is whether they were filed on in court for another offense post participating in diversion. So we look after their discharge date. That's why it's very important to get those discharge dates in the juvenile case management system. And then we wanted to look at whether this predictive validity was similar by gender and race and ethnicity, right? So is the tool predicting risk of reoffending similar for boys as it does for girls, for example? And then what we also sought to look at is whether there's specific items that are doing a better job than other items. Okay, so like I said, we in many instances went on site to gather item level data for each of these assessment tools. In some instances, I spent many hours in the file cabinet rooms of various diversion offices along with some of my students. And we were able to pull the files and to record the individual item level data for each of these 3 tools. So thank you to everybody who allowed us to come in and do that. We really appreciate it. So we were able to get about over 2,000 cases for the YLS, and those come from Douglas and Sarpy counties. The Nebraska Youth Screen, about 1,500, those come from Lancaster County and most other counties. So the NYS, or the Nebraska Youth Screen, is the most commonly used tool in terms of the number of communities that use it. And then there was a couple of communities that use the Arizona Risk Assessment tool. So remember, and I think those were older, those communities used the tool previously, but I don't think they use it anymore. But keep in mind, this was older data from 2015 to 2017. We took that assessment data and we merged it with the data that diversion programs enter into the juvenile case management system so that we could get information about the referral date, discharge date, gender, race, ethnicity, age. And then finally, in order to look at future system involvement, and also to look at whether they successfully completed diversion. So that was in the juvenile case management system. And then we merged that with justice data, which is the trial court database that keeps track of all cases that are filed in court. And when we do this analysis, we get the data directly from justice, and we are able to look at both sealed and unsealed cases, which of course is really important in this work, because if you don't look at the sealed cases, you'd be missing at least, I think, 50 to 60% of the recidivism data. All right, so I'm just going to go through each tool and kind of highlight some of the things that we found. We did find that the YLS significantly predicted future system involvement, but it had a pretty small effect, and it did predict whether someone was whether they unsuccessfully completed diversion. However, we found that it was not predictive of recidivism for Black or Hispanic youth, but it was predictive for both boys and girls. And you'll see in the reliability box that looks at each of the subdomains. And really, one of the things that we find to be the most having the lowest reliability, so that means is it measuring things in a consistent way, is that first domain within the YLS, which measures prior and current offenses. If you keep in mind, these are diversion kids, right? Many of them don't have prior offenses before coming to diversion, right? That's part of why they're in diversion. And so those items do a very poor job at measuring, they do a very poor job at contributing to the predictive validity of these tools. And so one of the things in developing a statewide tool that I think is important is that, you know, we're looking at the population here. A lot of the YLS was normed and developed for kids that are in detention and probably probation. And so this is designed to predict youth that are higher risk. So that item ends up not being very useful or important because it's mostly zeros. All right, so the NYS, the Nebraska Youth Screen, also significantly predicted future system involvement with a small effect, which kind of makes sense, right? When we're making predictions about things like whether somebody reoffends, Their risk level is obviously not going to 100% predict whether they reoffend. There's, of course, a lot of other things that go into that. Their, race, ethnicity, gender, where they live, the whole host of things. So it's not surprising when the effect sizes are small. And it was only in 6 of our counties, so it wasn't in all counties, but it did predict successful completion of diversion with a larger effect size. But again, it was not predictive of recidivism for Black or Hispanic youth, and it was not predictive for girls, only boys. And lastly, the Arizona, or the ARNA, this also significantly predicted recidivism, as well as unsuccessful diversion completion. However, it wasn't predictive for girls, but we didn't remember the Arizona is not used as frequently, right? So there's only about 200 kids. So when you have a smaller sample size, it's not surprising when you have a small end and it's not as predictive. It was predicted for white and Hispanic youth, but there wasn't enough Black youth in the sample to be included in the analysis. So we don't know if it would be predictive for Black youth. So what works best in Nebraska? Well, at the time of this report, our best suggestion was that it was a work in progress. We obviously have some mixed findings with some tools performing better than others. But at the time, our recommendation was to continue obviously using these tools because they are being used for case management, right? So we're able to identify needs and design diversion plans around them. But now we're at the point where we are doing the work of developing a state tool. So our recommendations back then were to develop a tool more appropriate for lower risk youth, perhaps a pre and post measure to examine whether post-diversion assessment is more predictive, and then to screen youth and only assess those who are higher risk. So why have a statewide tool? I kind of alluded to this a little bit. But one of the ideas is to develop a tool that's more appropriate for the kids in our state to be able to account for things like race and gender. And then the other thing is that, we do have this statewide juvenile case management system where we're able to evaluate different diversion practices to see what's most effective to be able to share it with everybody. And by everyone using the same risk assessment tool, just from a research perspective, which is, of course, the cap that I think about, it makes comparisons across programs more standardized than programs using different tools. All right, so I'm now going to turn things over to Zach. We are going to swap screen sharing. And Zach, you're on mute whenever you get a chance, and I'm going to mute myself.
Can you hear me now? Excellent. All right. Thank you all for letting me present. I thought I'd just give a little bit of background about myself and let you know that I actually do have an office at UNO. I don't always lecture from this wonderful basement, but this is the quietest room in my house, so hopefully you won't have to hear the dog bark or my kids doing school upstairs. But we shall see. So I was asked to just say a little bit about myself before I get going. I'm currently an associate professor at University of Nebraska, Omaha. My education and professional history, I started out, I was born in Iowa, received my bachelor's degree from the University of Iowa, where I then went to New Jersey and received my master's and PhD from Rutgers University. While I was there, I worked at a few nonprofits. One was the National Development Research Institutes, where we worked a lot on substance abuse treatment and programming. And then I also worked for the Center for Court Innovation, which you may know does a lot with specialty courts and drug courts, mental health courts, community courts, things like that. As for my academic experience prior to being arriving at UNO, I was a assistant and then an associate professor at Washington State University for nearly 10 years before eventually coming here this summer. As far as what I do for my living, my research experience, I have a lot of program and policy evaluation experience. Most of my publications are around that sort of area, but in the last 5 to 10 years, I've focused almost exclusively on risk and needs assessment, building several adult and juvenile tools. I've built the Washington State Department of Corrections risk assessment, currently called the Strong R. We also implemented that for Nebraska, for NDCS, for King County in Washington, which is where Seattle is, as well as the Tennessee Department of Corrections, and currently we're working on one for the Pennsylvania Department of Corrections. You may also know of the First Step Act. That was a bill that was passed, a bipartisan legislation that was passed to allow individuals to be released early from federal prison, and it required a risk assessment to identify the lowest of the lowest risk of individuals for those to be eligible for early release, and I completed that over the summer. As for juvenile experience, what I've done so far is, and I'll explain a little bit as we go along here, but I started out in Washington, and we remade their juvenile risk assessment tool. It was initially called the Washington State Juvenile Risk Assessment, and then eventually a software company put it into software and created it as the PACT. Another software company took this tool and created it as the YAZI. So you may know it under a couple different names. It's also implemented in Iowa and some other jurisdictions under some generic names. I think Iowa just calls it their delinquency assessment, or the IDA. But it's provided in many states, and it's part of what I'm going to describe in a little bit, an OJJDP study that we recently completed. With regards to sort of the historical development of risk assessments and how it sort of relates to the tool that we're going to build, there's a long history of both adult and juvenile risk assessments. When I talk about contemporary tools, typically what people are referring to as contemporary are those that are identified as fourth generation tools. First generation was those tools that weren't actually tools. It was just educated judgment based on experienced individuals working with youth, and then they worked their way to tools that were only based on criminal history or static predictors, and then needs items or protective factors were added in the third generation, and then the fourth generation, there started to be items that would track responsivity factors or elements that would make somebody a good or a poor fit for programs and interventions. There are several common fourth generation contemporary tools that are out there. The YLS is one of them. Recently, I would say within the past 10 years, some others have been created. The Ohio Youth Assessment, or the OYAS, the Savory, and the Youth Compass have all been created within the last 10 to 15 years. The YAZI and the PACT are fourth generation tools, and actually this combination, going by the same tool but going by two different names, is utilized in a lot of different states. I wrote a few down: Washington State, Wisconsin, Colorado, Iowa, Florida, Texas, Oregon, New York, Virginia, Maryland, Montana, and Utah, just to name a few. And there's lots of different counties that utilize the YAZI and the PAC. So I know that it's not one that you may not have a lot of experience with, given the three that are used in the state, but this particular tool is used under a lot of different names across the country. With regards to changes that have been made since sort of the term of art of fourth generation was created, there's been a lot of updates with regards to how people can build risk assessments or even improve those that are in existence. Typically what happens is that when a tool is developed, it's developed with a single sample. Some of the tools that I've listed there as common tools might be built with just a few hundred youth, and some of them are built with thousands or more in one location. And the way that a tool is typically developed is that there's a pool of items that are explored or investigated and tested. And once that pool of items has been pilot tested within a given sample, again, maybe a few hundred or a few thousand, items are selected, and then their response weights are provided to create a more accurate version of that particular tool. There's little sophistication that's gone into a lot of these tools as they work their way up to the 4th generation. And a lot of the methods are sort of similar, dating all the way back to the 1980s. But what we've seen within the last 5 to 7 years is that the sophistication of building these tools and locally identifying items and weights that work best for a given environment tend to have a better prediction around them. And this really gets at the idea of prediction shrinkage. Prediction shrinkage means that a tool is developed somewhere else. Maybe it's developed in Canada or Arizona or Colorado or Ohio, and it's developed with that sample of maybe a few hundred or a few thousand, and the items and the weights that are created within that tool are then transferred and taken what we call off the shelf and placed within a new environment. And there's lots of things about that new environment that are hard to explain, but they tend to make that tool less effective or less accurate as compared to where it was originally developed. And that's where the whole idea of shrinkage comes from, is that if you take a tool from, say, Ohio and place it in Nebraska, you're not going to get the same result, and it's likely going to have reduced accuracy when it's placed in that new environment. And so what happens is that you have shrinkage, it creates errors, and you get missed predictions, and people get classified within the wrong category as compared to where they actually should be classified. So as we've seen within sort of the last 5 to 7 years, there's multiple advancements that have sort of pushed these 4th generation tools a little bit further. And what I'm going to describe is the process of optimization. And optimization is essentially taking a tool that might be one of these off-the-shelf tools and specifying it more accurately for that given agency. And a lot of what's been done around optimization are these 4 bullets that I'm going to walk through here. The first is looking at how that particular agency wants to specify their outcome. That is, what do they want to predict? Typically, there's a general recidivism, sort of any recidivism, whether or not that's a charge or a conviction, whether or not it's a felony or misdemeanor or both. All of those definitional changes between the agency and the developmental site in which the tool was created create variations in predictive accuracy. You can also look at more specificity in terms of what you want to predict. So some individuals or some agencies want to predict not just general or any recidivism, but also violent, property, drug, or even sex offending. And typically, what's been done with 4th generation tools is trying to predict an individual's needs, and do individuals with high or moderate needs end up having greater levels of recidivism as well. So breaking down that risk into buckets of need that you can then program a youth and ameliorate. Gender responsivity became very important and sort of came on the scene in 2010 with some of the work that Pat Van Voorhis has done, looking at item selection and weighting by gender. So your larger tool is going to typically be 80% male population, 20% female population. And what gender responsivity does within a risk assessment is create essentially 2 instruments. One where you select and weight items just for the male population, and a second where you select and weight items for a female population. And what they found is that by doing this, you reduce the overclassification of female risk. That is, female youth or female offenders will typically find their way into the higher levels of risk or be identified as riskier in those general tools. But when they're created in sort of a gender responsive framework, they tend to have better accuracy for females. The third, and probably one of the more important processes, is analytical weighting. This gets into some of the nerdy things that I'll gloss over a little bit, but it has to do with using more advanced statistical models to create those response weights based on how important they are for your local environment. That means, even though whether or not somebody uses substances or has issues with substances within the last 6 months, that might be important to risk, but maybe their number of prior felonies is more important to their risk of future recidivism. So they get weighted differently in terms of the values that you provide. And finally, the fourth bullet here is looking at local modifications to the tool development. So 1 through 3 can happen for all of those off-the-shelf tools in that development population, but breaking down how that tool works within the local population is the most important. That means collecting your data locally. That means creating those definitions of recidivism, whether or not you're looking at a 12-month follow-up or a 24-month follow-up or 36, or whether or not you want to examine, any recidivism or specifically tackle felony recidivism. And then setting your cut points in terms of how you identify someone as low, moderate, or high risk can be done at the agency level as well to provide a more utilitarian version of where those cut points are set so that you can tailor your risk categories to your agency's resources. So with that in mind, I'll talk a little bit about the study that we recently completed. My colleagues and I completed a 2.5-year OJJDP study in which we collected 10 states worth of risk assessment data. And the risk assessment that was collected is that PACT or YASI, or sometimes those generic derivatives that are used in other states. But it's all that same tool that was originally created in Washington State. Because it's been around for so long, I think that it's less well known just because it goes by those different names, but it's been around for so long that we were able to gather 500,000 assessments, which was nearly 250,000 unique youth. And by assembling such a large data set that spanned all of the different regions of the country, we were able to isolate and evaluate how well optimization works in terms of developing risk assessment tools locally. And what we did was we developed a new model for each one of those states that was using that PACT or YASI assessment. And 3 of those states, namely Delaware, Iowa, and Washington State, are taking those models that we created for them and redesigning their risk assessment tool. Essentially what we did was identify which items were not working well for their particular population and eliminated them. And we reweighted those that were more stronger predictors of their local youth. And the finding was that we identified that we could optimize their tool and increase the accuracy at that local level by more than 10% across all 10 of the states that we examined. And a lot of the recommendations that we came up with was this idea that local data needs to be used to validate and implement a tool, that if you're taking that tool off the shelf, you're losing a fair amount of the predictive accuracy, and sometimes they can be off quite a bit. We're also recommending incorporating those new advancements, looking at gender responsivity, looking at outcome specificity, and the statistical modeling to improve the performance at that local level as well. And so what optimization does is it demonstrates that you can substantially improve your risk assessment's accuracy by tweaking and really ratcheting up how accurate you are with those particular elements. And the bonus is that you're actually able to create an iterative environment with your risk assessment in which the stakeholders on the ground sort of take ownership within that risk assessment. You're collecting the data that eventually updates and changes how that risk assessment is applied and some of the items and the weights that are within it. And what we found is that ultimately that has an improvement on stakeholder buy-in, because it's not taking that tool that's based in Canada or Ohio and trying to get it to fit in the square peg in the round hole situation. You're actually reshaping the pegs so that they work better for your localized data. And so what we're working towards now is to create a Nebraska diversion tool. And a lot of the issues that we wanted to resolve were those that were discussed earlier, and that there's multiple tools, the YLS, the NYS, and the Arizona Risk Needs Assessment, that create sort of inconsistent uses, and it really creates a difficulty in terms of identifying what low risk with one tool means versus low risk with another tool. And also to offer ways of making a tool that is reflective of this unique diversion population in which there's lots of different developmental samples that could have an impact. Because all 3 tools were there, it creates a lack of a standardized approach and inconsistencies across the counties. And so that the study that was referenced earlier by Rufino was that it was recommended that this assessment be changed in Nebraska to fit the Nebraska population, creating one single assessment that's calibrated specifically for your local youth. And so the current project that we're doing is, or that we're trying to complete, is to develop a tool using Nebraska specific data. And the process that we're utilizing is what we call a proxy sample process. And I'll get into that in a little bit, but essentially what we've done is we've taken that large data set of 2,000 to 3,000 youth that Lindsay spoke about earlier, and are crafting a new risk assessment utilizing that information. And we're working towards assessing and implementing that tool. And the way that we're going to do this is that we've set out a goal to optimize the tool for your particular state. Typically, when you're developing a risk assessment at the local level, it takes a long time. I'm going to show you exactly how we're planning on doing it here. But if you were to create a tool from scratch, the 4 steps you would go through is to create that item pool. So think about all those items that are in the YLS or in the Nebraska tool or the Arizona tool. They actually started off with a larger pool of items than the ones that you see, and reduced it down by pilot testing that and examining that within their particular local development sample. And by doing that, they could create either a screening or risk or a needs assessment tool, whatever they were looking at. The second step is then to implement and gather that data. So in that larger pool, you have to gather data and then analyze that data to see which items should be removed, which items should be retained, and how to weight those responses. You then would have to train, implement, and repeat that process over time. And typically what's recommended is that when you're creating a tool from scratch, this will be a 2 to 5 year process before you eventually arrive at a finished product or a finished tool. What we're able to do for this Nebraska project is to create what I've sort of termed a novel shortcut. Because we have this large representative sample that we collected for our OJJDP study, we're able to take that PACT and YASI data and use it sort of as a background or a frame of reference for your tool or for this diversion tool. We previously collected using that previously collected sample of youth on those 3 separate tools that Lindsay spoke of, the YLS, the Arizona, and the Nebraska tool, we're able to take use responses and match them to items within the PACT and the YASI data. And what we've essentially done is pulled out individuals from that 500,000 sample youth and identify which cases, based on their response patterns, match to Nebraska cases. And then we're able to take those cases and create what we call a proxy sample. So it's a Nebraska-like sample of youth that have been administered the PACT or the YASI and have recidivism information that we can track. We're then going to analyze that data and develop a version of that PACT or YASI tool that represents a Nebraska-like population or represents that proxy sample. After we're done with that, we can train and implement the tool and collect data locally for what we think should be 2, maybe a little bit more years, and then recalibrate the tool for a second version on just Nebraska-specific data rather than that proxy sample. What we've done so far is we've collected or we've analyzed that data that was previously collected, the YLS, the Nebraska and the Arizona risk need assessment, analyzed that data and crosswalked all of the items that are similar to within those 3 tools to the PACT and YASI data, and we've created our match sample. Our match sample is a really strong statistical model, and what we found was that we had good results, and we found a strong match between your sample and the sample of youth that we collected in the PACT YASI data or that OJJDP sample that I mentioned earlier. We've then taken that proxy sample that we've identified and we've run some preliminary models. Now there's still some work to do, but what we've done so far is create 2 separate models, one for males and one for females, in which we're predicting recidivism based on Nebraska's definition. And what we're finding are pretty strong results, moderate to strong predictive accuracy. It wasn't mentioned before, but I'll mention it here if you don't know about it. Typically when you try to assess how strong or accurate a risk assessment tool is, you'll oftentimes see in the literature the AUC or the area under the curve reported. It's sort of the industry standard to identify how accurate a tool is. It typically ranges from 0.5 to 1. 0.5 is tantamount to flipping a coin flip, saying, you know, the youth comes into your office, heads, I think you're high risk, tails, you're low risk. That would be a terrible tool, and that's at the lowest end of the range. 1 is perfect prediction, and maybe being able to have an accurate prediction every single time that you would know when somebody would recidivate and when they would not. And what we've established, or what the field has established, are that there's 3 or 4 ranges of AUCs that you can identify to say how strong your tool is at predicting future recidivism. Between 0.5 and 0.63 is considered small or weak prediction strength. Between 6.4 and 0.7 is considered moderate, and 0.71 and above is considered strong. Typically what you see of juvenile risk assessment tools, either their development samples or where they're revalidated, you'll see them within the small to moderate range. So usually within the 6s is what you typically see, the low 6s. Our preliminary models for what we've created using your Nebraska proxy sample are that we're identifying very high moderate to close to strong predictive strength of your sample. We're finding AUCs that are around 6.9 to 7, and we hope that as we continue to refine those models, we might push them up even further so that you've got a really strong model that's reflective of the Nebraska population. We have some remaining steps that are just sort of outlined here in the process. We're going to seek to finalize these models. Like I said, we're still in the preliminary stages. So we've created the sample, we've matched the sample, we've run our initial preliminary models, but there's still some refinement to do to complete that analysis. And then we'll go about setting those risk category cut points, identifying where do we set the cut points to say who's low, who's moderate and high risk, and the proportion of youth that will fall into each one of those categories. We'll go through some good back and forth vetting those models with subject matter experts, making sure that they retain face validity and make sure that they're appropriately applied to that specific sample of youth. We'll eventually produce a final report and present our findings. Hopefully by then I'll be able to do that in person, but still willing to do it virtually from my basement if that's required as well. After that, after a tool is complete, we will hand it off to you all. And the process from there is still some more collaboration, but it's more that it becomes your tool rather than ours. So there would hopefully be a chance to run a small pilot to make sure that everything's working out, that the items are reliable. If there's any issues, we'd like to modify it at that particular point in time, making adjustments to scores, maybe taking items out or changing weights, small modifications to get the tool sort of shipshape before eventually running it into training scenarios. Once it's set, you would train your assessors on the tool. And we would assist with that as well. And then you would implement the tool, and hopefully there would only be a need to make small minor adjustments as things start to roll out. But again, I've put a TBD there just because that's still far enough away in the future that it's difficult to say how quickly or expeditiously we could get that done. Finally, point 3 here, this would happen probably 2 or more years away from now, is that you would collect data on that newly implemented tool. And like we said, we're creating it on a match sample, so it's a Nebraska-like sample. It's youth that look like your population, but after you've collected data using your own population, we could then take that information and recalibrate the tool into version 2, utilizing your local Nebraska youth sample to train that model. And we would then go about repeating those steps above, although it would go a little bit quicker and make some less dramatic adjustments as we go forward. This iterative process is seen as an organic process in which you're able to adjust for the changes within your population as they change over time, as well as making sure that the tool is most reflective of the Nebraska diversion population. And these modifications tend to, again, as we found in prior research, create better stakeholder buy-in, create better face validity, and allow that local agency to have ownership in how their youth are being assessed and how that tool is developed for their local population. And that's all I have for today.
So if you have any questions, you can put them in the chat box. Amy Hoffman is also with us, so she can answer any questions related to implementation and timeline. Zach and I can answer questions about the development of the tool. I do have a question for you, Zach. So obviously within states, there's also diversity, right? So we have rural communities, we have more metro communities. How does the tool account for those things? And sort of in future iterations, is it possible that the weighting in the tools would differ by the different communities within the state?
That's one possibility. It's not common to change the way that you select or weight items based on a particular county. Then instead of making a statewide universal assessment, you're making county-specific assessments, which kind of goes against creating that consistency and uniform result. But what we can do, we could do that. I wouldn't necessarily recommend it. But what is most often done is that we're able to examine variations across those samples and identify are there differences in terms of youth that respond yes or no to one question or another? Does the prevalence of any particular item differ? And we can break that down not only by county, but by race and ethnicity and by gender to identify how consistent or reliable each one of those items are. And if we're finding particular issues with given items, then those would be sort of the subject of ones that we might remove after the first iteration, taking them out and changing them up to have a more reliable tool.
We had a request to stop screen sharing so that both of our faces can pop up.
Okay. There we go. Any questions? I don't see anything popping in the chat. Oh, here we go. Nope, that's Jenny indicating to post questions in the comment section. Amy, one thing you might answer is maybe timeline for folks that are here. I'm sure the diversion programs. Amy says in the chat box, we will be asking all diversion programs to switch to the new tool. Does anybody have questions about that? So one of the questions is that JCMS would reflect the new assessment. Yes, so currently the way JCMS is broken down by domains, and we anticipate that the domains would remain relatively similar, but yes, the JCMS would then be tailored to using the assessment tool. So will it be required to use the new tool? To receive CBA funding? That's Amy's call. Mental behavioral health screening assessment tools can still be used separately if there's a demonstrated need for it. So I think if somebody wanted, if there's a noted need for mental health that required additional screening for mental health, then it would be completely appropriate to also give a mental health screening. Will this take place for the MAISY too? Doug, the MAISY is specific to mental health. This tool would look at risk and needs. So it would identify the risk level of the youth as well as the needs that they have so that you can design your diversion plans. It won't cost anything. One of the questions was how much will this cost? So the Crime Commission is
paying for this assessment, and then that means the tool is ours, so it won't cost any money. So Amy says, just in case you're not catching the chat box, I don't know yet if we would require it for CBA program funding. It's possible. It's my hope that all diversion programs are excited about the new tool and want to use it, and that hopefully we don't have to go down the road of enforcing it. And then there was a question about training. Zach, you did mention training a little bit, but could you talk maybe a little bit more about what training would look like?
Sure, I can. And I'm not a very detailed trainer. Typically, some other trainer would be brought in to do these sort of things that would have more experience in teaching your people locally on the ground. But typically what's done is that once the tool is created and it's put into sort of a digestible format, whether or not that's in software or whether or not that's a pencil paper version, there's usually a manual that goes along with the tool, and that's very easily created. That manual is then provided as part of the training, in which there's item definitions for each one of those questions, so that when you get into sort of those gray areas of particular responses, individuals know which way to turn. There is also training typically around, risk, need, responsivity, just as sort of a refresher that goes with that as well. And then eventually you get into the phases of doing some practice assessments and assessing reliability strength or inter-rater reliability. So what's commonly done is that there's video recordings of interviews with youth in which individuals that would be trained on the assessment would be trying to assess or score the tool based on those pre-recorded interviews. And then you can assess how well they did by comparison to how the tool should have been scored for those particular responses. Is that enough, or did you want more?
I think that's probably good.
Okay.
So one of the questions is, will this tool include some assistance in determining who needs a mental behavioral health assessment, something more than just risk to reoffend? So maybe you could talk about the domains that it'll measure and kind of what people can do with that in terms of case management and further assessment.
Sure, and if anyone's interested or has more questions about the items or the responses in the tool, I'm happy to send around some literature afterwards. What was the question you asked me? Sorry, I got off on a tangent.
So will the new tool include some assistance in determining who needs mental behavioral health assessment? So if you could talk about the domains and the use of additional tools once a need is presented as being higher.
Sure. Some of the domains that are in the tool are similar to many of the other contemporary tools that are out there. It's probably most similar to the YLS in terms of there's a domain that examines education and employment needs. There's another one for attitudes and behaviors, as well as aggression, skills that the youth might have, leisure and recreation, as well as family, mental health. Are all domains that are within there. Many of the domains will identify some sort of indication of low, moderate, or high need based on the youth's responses within sort of those particular subscales of domains. And those are considered flags in which some agencies say, that's all that I need. I can, refer somebody to a program based just on sort of a moderate or a high need indicator from the domain. Some agencies take the added step or the added precaution of doing a more detailed assessment if sort of a moderate or a high need is identified by the assessment. So say, for instance, the mental health domain identified a high need for mental health. Some agencies will take it upon themselves to then screen that youth further with a more specified mental health assessment.
Okay. I just want to go back to a question, Lee, about reporting options, about it being area specific, statewide, demand, or annually. The assessment data is going to be entered into JCMS in the same way that you enter each new case. So it just becomes it's just another field within JCMS. So the report, I think I'm answering your question, I hope. It'll be the same quarterly reporting schedule that, that follows for CBA and diversion. Okay, here's a question for you, Zach. So when a youth scores for needs in multiple domains, right? So they're high in multiple domains. How do programs determine what to focus on without potentially overserving them?
That's a good question. There are two approaches, and we've looked at both approaches, and they both seem to work quite well. One is that within the tool, we're able to identify which domains are most predictive of future recidivism. And within those domains, you can identify low, moderate, or high, and then provide a ranked order to those domains. There's usually, within sort of a case management structure, some sort of sequence of programming that you would want to adhere to as well. And sometimes those are just general guidelines that have nothing to do with the tool, but relate to how the tool is sort of spitting out those results. So if a youth needed mental health services, that sequence is usually first in line, where the other sort of behavioral programs or services come later. Those are sort of general rules that subject matter experts can lay out in terms of how they want the tool to be used. With regards to their needs, if they're scoring high in multiple areas, you can either develop a sequence of how those should be taken care of, or what is the preferred order, or we can construct, based on statistical models, a way to identify which domains are going to be most impactful for your agency or for your particular youth, based on their relationship to recidivism. So typically what we see are the domains that are most impactful are those that relate to attitudes, behaviors, aggression, and commonly family as well.
So another question here. Is there a domain for measuring something like sexual health or healthy relationships? We're finding this is an issue with some juveniles that I work with. I know right now it's not included in the assessments we're using. And I guess if it's not a domain, I don't know if there's suggestions about how to measure that or other tools, or anyway.
Did you say sexual health and healthy relationships?
Sexual health and healthy relationships.
Sexual health, I'm not thinking through the tool. I don't think there's items that specifically relate to sexual health. There are items within the tool that examine healthy relationships, and in particular relationships, not just with a youth's romantic relationships, but also their family relationships and any other relationships that they might have with peers or adults. Those are definitely covered within it. Looking at sort of those dependencies as well, there's some items that work their way into the drug and alcohol section of the tool that also look at healthy relationships as well. But if this is becoming more of a concern, it sort of gives an opportunity to discuss how those iterations might work going forward as well, because the tool becomes your own after this sort of initial version. We've done things with other agencies in which we call beta testing of items. So if there's additional items that you'd like to include, you can collect that data during iteration 1. It wouldn't necessarily score or change the risk or need level, but we could at least collect that information. And once we got to version 2, we can then test out how well it predicts for recidivism or whether or not you want to develop a domain around that. But again, some people like that approach by collecting their own data and do that beta testing process. Others like to have a separate assessment in which they can score more specifically if there's a particular area that they think their population of youth will need.
And how long does the assessment generally take in minutes? And maybe talk about the screener and the assessment, I think, that you're developing.
Sure. The tool itself, the the sort of boxed version of the tool, has two different versions. So there's a screener, and then there's a full assessment. The screener is about 23, 25 items depending on the site. Some of those items have to do with information that can be filled out from existing records on the youth. So, prior criminal history, age, gender, things like that. And then the other items refer to their social history, which is split. Criminal history, social history is about half and half of the tool. And the screening assessment doesn't take much time at all. It takes 15 to 20 minutes to complete the screener. If an individual is identified to be not low risk, so they're moderate or high risk, then the full assessment is there, and the full assessment has more of a focus on that social history element, in which you're really diving deeper into the domains. And if you put the screener and the full assessment together for a given youth, who again might be scoring moderate or high on that screener assessment, you're looking at a 45-minute assessment for the full assessment. And that's really to just dive down deep into their needs and hopefully make referrals to more specified programming.
Awesome. Okay. All right. So how do you disentangle needs and recidivism correlation in domains where we currently or historically do not have good programs to serve youth, so as to ameliorate their risk in that area? So I think he's asking, how do you disentangle like not having appropriate programming in the area with how predictive the tool is? Joseph, you can correct me if I'm wrong, but that's kind of what it sounds like.
So yeah, I think I'm understanding, but I just want to say.
I can copy the question into our Zoom chat if it's helpful for you to like actually read the words.
Disentangle risk recidivism correlation in domains where we currently or historically do not have good programs to serve it. In terms of the tool and how it's constructed and created, it's predicting the way that it should. It's predicting the way that the data is demonstrating which items and responses are predictive of needs or recidivism. If there is not a program that goes along with a given domain, it doesn't change the way that the tool is developed. It might change the way that you all program around the youth. That is to say, if a youth comes in as moderate or high in the aggression domain, and you all don't have a program that deals with aggression, that can leave open the opportunity to develop a program for that particular domain, or it's a way of identifying what's needed for youth that might not be addressed with current programming. And so a lot of times, even though it's not as predictive, or there's not a given program that can attach to each one of those domains, it's still helpful information from a case management perspective to identify what the issues are that youth is having. I hope I answered that question. It's kind of sticky though.
There's a couple more things coming in. So I think the question is maybe like, as you're looking at these and how predictive the new tool is, if programs are serving the kids really well and they're not recidivating at all, will we have a difficult time in these future iterations seeing if the tool is predictive? Like, so I guess, how do you account for going through diversion and being successfully served when looking at these tools and how it's affecting recidivism?
Well, for the full assessment for individuals that are not screened to be low risk, for those individuals that are getting a fuller assessment, there's a reassessment process that goes on. You can do that as frequently as every 6 months, or you can do it in a longer duration. But that reassessment is going to be measuring those domains specifically. So looking at their aggression, their attitudes and behavior, as well as sort of their alcohol and substance use. And you should see intermediate targets start to decrease in terms of their level of need within those given domains. Programming, if they're going through programming and you're ameliorating those issues that the youth are having, you should see a reduction in those scores over time as you go from the initial to reassessment.
Is there a parent component to the tool, like interviewing parents as well?
There can be, yes. It depends on how the agency likes to operate the tool, but yes, you're part of the structured interview that's done for the fuller assessment incorporates identifying or substantiating information within the tool, and oftentimes agencies will incorporate interviews with the parents to get clarity on certain portions of the questions.
That was asked twice. Sorry, I just saw somebody else ask that earlier too. So in terms of timeline, Amy, if you're on, I think the goal is that we would start next fiscal year in July, but correct me if I'm wrong, because I think your work, Zach, is happening this year. So we would be ready next summer in July. Someone asked, at what point will we do a second assessment? I don't know if a second assessment is really part of this. I think he was just trying to answer a question, but I don't know if that's, maybe I shouldn't try to answer for you. At what point would we do a second assessment?
It depends on how long you typically service youth. So if through diversion, those individuals are in and out rather quickly, then there might not be a need or a duration of time to provide a second reassessment. I mentioned it briefly earlier, but there's not a ton of information on the specific timing of when a reassessment needs to be done. Usually people say that anytime you do one inside of 6 months from the prior assessment, that's probably too quick. You're not going to be able to measure changes in youth behavior if you're doing them faster than 6 months. But some provide assessments or reassessments based on event, or make event-driven changes in their reassessment. So say, for instance, a youth got a job, or they got their GED, or their living situation changed. Sometimes those events can be adjusted within the risk assessment, and it'll change those scores right away. It wouldn't necessarily require one to reassess all of the items, just the ones that are specific that are noted to change. So it's two different approaches. You can set a duration of time of when a reassessment is supposed to occur, or you can do event-driven assessments, and it all depends on the agency.
And we had a question come in that said, are the assessments designed to do pre-post and additional assessments? But then they said you just answered that question. So
good.
If I missed your question, please feel free to retype it in. I think I caught them all, but it's possible I didn't. Not any additional questions, just a couple little hand claps. So. Okay, well, I don't see anything else coming in. You know, if you are a diversion program, there will be probably more information coming out in terms of timeline and what to expect. But we just wanted to give you kind of an idea of what we are working on to kind of prepare you to think about some of these things. I'm glad, thank you, that people are excited about this. I'm excited about it too. Is this interview or paper, Zach, the format of the tool?
It's been done both ways. Is it interview or paper? Sorry, that threw me for somewhat of a loop. There is an interview portion, and it can be collected on paper, or it can be done in software. So there's definitely a part where you're looking at the individual's criminal history and their record, and that fills out a few of the initial questions. Then the structured interview is there, and that requires some training. But the structured interview is there to fill in the rest of the tool. And the way that somebody does that, whether or not it's a pencil paper scoring, or whether or not it's in software, the software is the preferred way. That's up to the agency.
All right.
I already
there's
shut
no
you guys off.
Oh, well, there's one more question. So how does gender identity, if different from their sex, affect the gender portion of the assessment? So we talk a lot about having one for boys and one for girls, but obviously for people that are non-binary, how does that affect the tool?
Yeah, that's another agency by agency decision. I can tell you there's no assessment that I'm aware of that considers that. And many of those that are examining gender neutral assessments, like I said, it mostly tilts their scales towards male youth. And so the way that it can be handled is that a gender neutral model can be built, or what's typically been done by other agencies is that the youth can select which one of the models that they feel suits them better. So it can be done in a couple different ways. One is a gender neutral version. The other one is one in which you allow the youth to self-identify.
And when do we think, so if we're starting this sometime in early July, when do you think there'd be a rough draft or some sort of document that the programs could look at ahead of time? I don't know if that's something that's available now, or if you still have more work to do in order to produce that.
Yeah, there's still more work to do. We still need to finish the modeling efforts, and there's a lot of vetting that takes place. It's not just something that I craft on my own time and you know, force people to use. It's one in which it's a collaborative interaction between subject matter experts to make sure that the tool is has the face validity that it should for your particular sample of youth. And some of those adjustments will be taking place over the next few months. As far as a report goes, describing what we've done and the tool that we've created, I would expect that to be sometime in the spring, that we could produce something like that, depending on how quickly the vetting process goes to where we could get to a final model. But if individuals are interested in some of the work that's been done in Iowa or in Washington, or the larger OJJDP study, or even the tool and its items itself, I'm happy to provide that to anyone who's interested.
So it sounds like programs will have the opportunity to look it over, and it'll be kind of a back and forth discussion, and they can provide feedback. Yeah. To be continued, Kim, on when that's coming, but probably sometime after the new year in the early spring, maybe. Yeah. All right, well, if there's no other questions, Jenny left us a little note to navigate back to the main hall to watch one of the agency highlights. And the next session in this room will be applying restorative justice principles in diversion programming at 2 o'clock. Of course, you can email myself or Dr. Hamilton if you have any additional questions that weren't answered, or if you think of something later on or something that you're just curious about, please email us. We can also forward you any materials or things that have been produced in the past related to the tool. So thank you everyone for joining us.